So, good morning. Today I will be explaining how to do a general, not checkup, but what you should be looking for with patient with general surgical respiratory disorders. That means patient which have Today, of course, there are many types of respiration surgeries, many types of procedures. You can have pneumothorax, for example, but today we'll be focusing the ones, for example, the trachea. So I'll be focusing on the tracheostomy, the laryngostomy, and the artificial respiration tube, which includes endotracheal tube. Uh, Today, the assistant is my sister, and I didn't put an actual tube in her, of course, but we will generally explain how you should conduct this type of assessment. So the first step is, because it's a delicate surgery, many patients cannot speak during the procedure, so you should be very careful with communication when doing these assessments. So you should not ask any question expecting for an answer, because that's not going to happen. So your type of approach should be different. So the first thing, you should present yourself to the patient. So, good morning, Victoria. My name is Sofia. Today I will be your nurse, and today I will be doing the assessment to your tube, okay? Are you okay? I hope so. So the first thing, you should look for vital signs. I'm not going to do this video because we already have in the channel, but you should look for her temperature, her pulse, her blood pressure, and her cardiac rate and respiratory rate. So you should be looking for abnormalities here. So we can draw all different types of procedure and a few abnormalities that you should be looking for. So in all of them, tracheostomy, laryngostomy, and endotracheal tube, you should be looking for any type of redness and swelling, because that should indicate bacteria or inflammation. So you should gently remove the tissue that is over the surgical spot. Here you should have a stoma on the opening. So around the stoma, you should be looking for redness, you should be looking for swallowing, you should be looking for any type of secretion. Of course, she doesn't have a tube, so we cannot show that, but we should be looking that around the stomach without any touching. You should ask her if it's hurting. So, Victoria, can you please blink your eyes twice if it's hurting, and once if everything's okay? So you should press, and if she's okay, she will blink once, and if she's not okay, she will blink twice, for example. That's the general signs. You should also be checking for generally any type of apnea, any difference. You should check for her history, for example, if she had any respiratory problems during the night, because there is some type of respiratory problems that they affect the patient in some times of the day. You should be also checking for any problems when it comes to swallowing and ingesting food, or any aspiration that happened in days before or after you're checking, because bronchial aspiration of food, there might be some left in the tracts, and that may cause some infection. So besides that, you should be also looking for low oxygen level, saturation, high inspiration pressure, and abnormal respiration actions in all the cases. And for all the tubes, you should be doing some procedures. So you should be doing with all of them, you should be doing both aspiration and cleansing. Aspiration and cleansing should be done not only by one procedure, but usually you have someone to help you. You should remove the towel, and then in the place, of course, you will have to clean around the stoma. You should have to clean inside the tube. In this part, is very important to have help, because you should aspirate to avoid any problem in the area or any infections. And for cleaning around the tube, you should have a clean wipe, a clean tissue, for example, and you should have a clean tissue, and you should have a clean tissue or any medical cleansing solution, and you should clean it around the stomach very gently, not to hurt the patient or anything. And then you should be seeing if there's any need to change the tracts. If there's any abnormalities, you should be informing the head doctor. And after that, you should put everything back together. Put back the towel, ask the patient if he's okay. So with that, everything's fine. Okay, so you should blink 1, which means it's fine. It's important to establish some sort of communication with this type of patients. So mine with Victoria was the blinking. So if it was 1, it was okay, twice not okay. So with that, I hope everything's fine. I will be coming back later today to check you again, okay? So that's all.